Welcome to Remedios and Saplala Elementary School. Despite the challenges posed by the pandemic, Remedios and Saplala Elementary School stands committed in carrying out its mission of providing first-rate education to its learners. Our educational system faces challenges in the continuity of learning. In these trying times, RNSES is contextualizing and localizing the learning continuity plan to ensure that learning modalities will be used to cater the different learning needs of our learners. Remedios and Saplala Elementary School, formerly Mati Elementary School, is located at the northeastern part of the Digos South District. It lies within the heart of Mati, Digos City, along the National Highway going to Cotabato City. It is accessible to any means of transportation. It was established in 1945, educating the children of school age for 75 years. It has an area of 1.2 hectares donated by the late Remedios and Saplala. For the school year 2021-2022, the school has a total teaching force of 2 male teachers and 24 female teachers with 1 female school principal. The school has a total population of 388 male and 356 female for a total of 744 school children as of December 2021. School-based management is a paradigm shift in education governance from being school-centered to become an access, a child and community-centered education system. This features the school linkages to community stakeholders, which comprises of parents, barangay council, and private individuals. The school is organized by a clear structure and work arrangements that promote shared leadership and governance and define the roles and responsibilities of the stakeholders. The Remedios and Saplala Elementary School adheres to the DepEd Order No. 12, Series of 2020, the adoption of the Basic Education Learning Continuity Plan for school years 2020-2021 to present in the light of the COVID-19 public health emergency. Remedios and Saplala Elementary School teachers' reskilling and upskilling manifest in in-service professional development and providing appropriate advancement as they continuously improve their teaching proficiency in the new normal. A series of webinars were conducted to address the current new normal situation, thereby equipping teachers with varied online trainings on the different blended approaches. Differentiated materials are given weekly to independent, instructional, and frustration readers that will help improve their reading skills. School reading and its initiated program greatly helps in improving literacy as key elements in teaching the basics of reading and comprehension. Strategic intervention material demonstrated great improvement in the least learned competencies in all grade levels. School Monitoring Evaluation and Adjustment, or ISMEA performance result, is evident in its enforcement. RNSES ISMEA highlights its plans and projects as planned and accomplished in school hitting the target of 100%. Active partnership with our stakeholders is evident in the signed Memorandum of Agreement or MOA and Memorandum of Understanding MOU for the aid extended to our school. Remedios and Saplala Elementary School highlights shared responsibility framework, key safety measures for pilot face-to-face implementation. In the joint memorandum circular of DepEd and DOH, the Remedios and Saplala Elementary School has adopted the shared responsibility framework in the pilot implementation of physical classes to strengthen the school community health and safety support system. The said joint memorandum circular features 4 key pillars, namely safe operations, teaching and learning, including the most marginalized, and well-being and protection. School safety assessment in preparation for the conduct of pilot implementation and face-to-face learning modality was conducted last January 11, 2022 by the Digo City Division Validation Team headed by Dr. Beverly S. Daog-Daog. Among the 27 teachers of Remedios and Saplala Elementary School, 25 are fully vaccinated and 2 had already received their booster shots. There are 2 unvaccinated female teachers. One is pregnant and willing to receive her vaccine shots after her delivery, while the other one chose to be swabbed every 2 weeks. RNSES is still on data gathering to determine the number of learners whose parents are willing to have the face-to-face classes modality in coordination with the barangay council officials, PTA officials, and the situ president.
Sa among mga ginikanan, uyon kami nga mag face-to-face ang mga bata nga adunay pagmatngon sa health protocols. Nakita namo ang kinahanglan sa mga bata ang pag-anhi sa tulunghaan para masabtan ang mga buluhaton sa modules or lesson o makabalo ang mga bata sa pagbasa.
The question is, uyon ba ko sa face-to-face class? Yes, because face-to-face class is a different training sa ato ang mga kabataan, unlike kung naalang sa balay. So, I agree for the face-to-face classes.
Ako masulti bahin sa face-to-face classes para din sa mga barangay o sa mga school. Preparado namin gani na may entrance o exit sa mga eskwelahan. Kunya ang among barangay council, headed by among punong barangay Ayan Maris Cabarte, ang daming motabang sa Remedios Saplala Elementary School. Wala may problema sa barangay tungod kay full support mi sa mga teacher. So far pwede na makapasumbod sa tuwang face-to-face classes tungod kay preparado na gid ang tanan.
Remedios and Saplala Elementary School highlight shared responsibility framework, key safety measures for pilot face-to-face implementation.
Basta RNSES, the best! The best!